So it looks like we have a comment. Is this a family member of yours? Can you read that, Char?
Yes.
I have a lot of unanswered questions about my thyroid issues, such as Graves' disease. Do you want to, thank you for the question. You want to answer that question, Char?
So it depends on what issue she's speaking of first. So we have to start there first and figure out what questions she directly has. Can she put an actual question on there?
Yeah, well, it says, yeah, that's true. She said such as Graves' disease. Let's talk about Graves' disease, just briefly.
Mm-hmm. So with Graves' disease, it's a very tricky one because many providers, they start off with just a thyroid stimulating hormone, which the thyroid stimulating hormone is the hormone that is transferred from the pituitary gland, and it tells the thyroid gland to go ahead and excrete the actual hormones, T3 and T4. There's other things that play a part in that, but that's just the basic. So once you get that TSH, that's where providers like to stop. They don't see it elevated or too low. They don't do anything else. But it's very important to look at that TSH and then that free T3, free T4, and et cetera. And then you also have to look at the antibodies. So that's where that Graves' disease come into play as well. So it's important, as a patient, when you're going to your provider and you're trying to figure out, do I have Graves' disease? Do I have Hashimoto's? Do I have subclinical hypothyroidism, et cetera? That you ask them, are you going to do a complete panel? Are you going to look at everything? Right. Don't just stop at that TSH. You have to be a self-advocate and start asking these questions instead of just saying, okay, well, this is the answer. And do some research on your own too. There's plenty of things out there, such as the NIH, which is a government type of website that's out there for patients to look at. There's CDC, you can go on there. There's plenty of things. I don't really care for WebMD that much. And Dr. Google and all of that. But when it comes to those kind of things, it's really important just to make sure that your physician or nurse practitioner or PA are actually doing the entire panel and looking at you as a whole person entirely.
Right. Order the right labs and know how to interpret them, because we treat patients, we don't treat lab levels. So it looks like she might have another specific question. Is this more specific? I have a lot of... Wasn't there a second?
That's the second one.
Here we go.
It says, I have a lot of questions about my thyroid, such as Graves' disease and synthroid. So I feel like it's too broad, but the treatment would be much different, correct? I mean, it depends on what their labs are as how you would approach your treatment.
Exactly. So go ahead, sir.
Well, many times, as you know, Char, is synthroid, which is levothyroxine, is not enough. Levothyroxine, which is T4, is the most popular drug ever prescribed in 2016. It was the number one drug in 2016. It's still by far and away the most popular thyroid drug prescribed. And for most patients, it might work okay. It probably does.
Right.
But for the ones that fall through the cracks and their TSH looks normal, but they still don't feel normal, many times you check that complete thyroid panel you're talking about, and you get a free T3, and their free T3 is low.
Right.
Well, levothyroxine, or T4, which is the brand name Synthroid, has to convert into T3 in order to be more active. And if you're not doing that very well, your T3 levels won't be low. Your T3 levels will be low, and you won't feel optimal.
Right. Definitely.
So I hope that answered your question, Mrs. Dean.
But, I think Graves' disease depends on it really depends on where they are in their treatment plan too, right? I mean, because if they're too high, they have to be treated properly. If they're too low, so there's a lot missing without having the physical and the laboratory results for you to be able to say, this is it, right?
Right.
It has to be painted for you.
Absolutely. And you have to look at the patient's symptoms and what they're going through at the time as well. I mean, everyone is in a different phase. There's different phases of Graves' disease. And so it doesn't just, it's not just the laboratory itself that's going to tell you how to manage this patient. It's also what
Right.
they're telling you that's going on
Right.
as well.
Mhm.
And I think now that we're on that subject, I think that's more important than labs. I mean, let's face it, we've been treating thyroid, low thyroid, before we had laboratory tests to treat it.
Right.
To monitor it. I mean, TSH came out in the 1970s, the specific TSH, but we've been treating thyroid for over 100 years.
Yeah, yeah. And there's the thing about thyroid is so interesting is that there's the nature thyroid, there's the armored thyroid, there's
Right.
the levothyroxine, there's cytomel, there's just so many different things now that are available to use, and it really depends on how your specific patient is going to absorb all of that, because not one person fits Synthroid levothyroxine. They don't. Sometimes you have to change them over to the armored thyroid or the nature thyroid,
Right.
because their bodies respond to it better. So I think that's another part of it as well, is that a lot of providers, they just know Synthroid, and they're not going to even bother looking at nature thyroid or armored thyroid or any of the others that are out there to manage their patient. And here their patient is still having the symptoms. Their labs are not coming out okay at all, but yet we want to go up and down, up and down, up and down on levothyroxine, and it's not doing anything.
Right. That's a good point. They end up chasing labs with levothyroxine, but either way, they're not feeling good. So you got to do something different.
Right. And that's where it all comes back into play. What is your patient saying? How are they feeling?
Exactly.